Thought I was getting on top of it all, it being the summertime, but I just remembered something I was supposed to do that I haven't done. So right, better crack on and do this video. From the title, you've seen that this video is about the intercostal neurovascular bundle, which sounds like a bit of a mouthful, but essentially we're talking about the neurovascular, the arteries and veins running between the ribs, intercostal. I can't remember why this is on my list. Did somebody ask me to do this, or maybe I was doing some thoracic cage stuff and thought, we haven't done that, I'll put it on my list so don't forget. And the anatomy here is quite neat and it's quite useful, so it's well worth covering. So, costal refers to the ribs, so when we're talking intercostal, we're talking between the ribs. Now the big things we've got in between the ribs, and we've done a video on ribs, pretty sure we've done a video on like the muscles of respiration, but the big things between the ribs are the muscles. So these are the intercostal muscles. Very sensible and straightforward so far. Now we've got 3 layers of muscle, and that 3 layers of muscle in the body wall it's the same in the abdomen and the thorax. The muscles are different down here, but that 3-layer idea forming the wall is the same. We're nice, neat, segmented, organised animals, right? And we can see the segmentation up here in the ribs, and that's what the intercostal neurovascular bundle is going to show us. It's going to show us how we're nice, neat, segmented animals. The 3 layers of muscle are the external intercostal muscle, the internal intercostal muscle, and the innermost intercostal muscle in the thorax, where we have them between the ribs. And the main aim of those muscles is to form a wall, a rigid wall, a pressure barrel, so that when you move the diaphragm and you move the ribs, the change in pressure inside the thorax causes air to be drawn in. And if you didn't have these muscles, when you breathed in, when you reduced the pressure inside the thorax, you'd get a little bit of a bowing in of the skin here. The other role of these muscles is actually to lift the ribs up and pull the ribs down, and we see those muscles being activated when we're doing that sort of thing. But the reason I'm talking about the intercostal muscles is we need to know about the layers to talk about where the neurovascular bundle runs, all right? So, what can we see? If we look posteriorly, this is the external intercostal muscle layer. It's going pretty much from the vertebrae and then running around underneath serratus anterior here. And can you see how it's ending here? Right, we've got this demarcation here. So this is external intercostal muscle here. So it only goes as far as this, about almost where this bit here. Now this layer underneath, now we can see the internal intercostal muscle layer, right here, which means that the internal intercostal muscle layer and with it the innermost intercostal muscle layer, they run from the sternum and then they run around between the ribs posteriorly, but we can't see them here because they're covered by the external layer, but they end here at the angle of the rib. Now the angle of the rib is where it changes angle, so it's kind of almost horizontal here, then it starts to dip. Right? This is what I mean about the angle of the rib. Can you see that all of these ribs are kind of parallel here, doing their thing, and then about here, they all change direction. See that shape? Kinda believe me? And that's important because you can see part of the neurovascular bundle here with the arteries and the veins, and you can see it disappearing. Now this is the parietal pleura. So the parietal pleura is lining the thoracic cage, right, internally, and the lungs are covered with visceral pleura. There's a video on pleura if you want to know more about that. So that means that the neurovascular bundle, so we can't see the nerves here, but they're with these blood vessels. We'll see those in a minute. Those are passing then. They disappear because they're being hidden by the parietal pleura. So they're going to run between the parietal pleura and the external intercostal muscle posteriorly. Really, the external intercostal muscle starts as a membrane. So really, this neurovascular bundle is running into a gap between the parietal pleura and a membrane. Do you get me? But then it becomes external intercostal muscle. And then as that neurovascular bundle runs its way around to the angle of the rib, where the internal intercostal muscle layer starts, then the intercostal neurovascular bundle runs around the thoracic wall between the internal intercostal muscle layer and the innermost intercostal muscle layer. That's what that was all about. Which means that in some areas that intercostal neurovascular bundle is beneath 2 layers of muscle. So it's deep to the external and internal intercostal muscle layers. See, you've got to do quite a bit of anatomy just to describe one bit. So the intercostal neurovascular bundle is running around between the ribs, and from about this point onwards, it's running between the internal intercostal muscle layer and the innermost intercostal muscle layer. One of the jobs of the nerves, the intercostal nerves then, is to innervate those muscles, which makes them very important. Now the rib itself, underneath these ribs, right, if you've got a plastic skeleton, you can't do this on yourself. If you've got a lab and you've got some skeletons, if you feel on the inferior surface of the rib, you can feel there's a groove there, right? So around here, it's a nice solid rib, but underneath here it gets a bit thin, gets a bit pointy. I'll show you. Now here's a rib, so it sits like this, right? And can you see then? This is the inferior aspect, this is the superior aspect. Can you see this groove? So the groove is pretty well pronounced around here, and then it's starting to disappear around here. But this is the costal groove, and in there, that's where we find that neurovascular bundle running. So the neurovascular bundle is actually quite well protected by the rib. It's up in here. So in that costal groove, we find the vein superior, the artery in the middle, and the nerve inferior. Now the reason I haven't really named these things yet is because the nerve is the intercostal nerve, and this is going to run around from posterior to anterior. It gives off a bunch of branches, we'll look at those. But the arteries, we have anterior intercostal arteries and posterior intercostal arteries, and we have anterior intercostal veins and posterior intercostal veins. So, why? Well, under here there's another couple of blood vessels. So what have we got in here? Well, posteriorly, I've nicked the heart. Posteriorly, heart sits in there. So we've got the superior vena cava and we've got the inferior vena cava. So up here in the thorax, you've got the superior vena cava really, and we've got the aorta looping around and descending here, right? So the posterior intercostal arteries are all coming off the aorta, and in fact, well, you can see it on here. Looks like an octopus tentacle or something. When we dissect, if we take out the aorta, we do see we see all these little branching ends of posterior intercostal arteries coming out from there. And then of course we talk about the direction of blood flow. So then the posterior intercostal veins, they're actually draining into, these are the azygos and hemiazygos veins over here. So the posterior intercostal veins are draining into the azygos and hemiazygos system, which then drains back into the superior vena cava up here. All right? But like I say, that's only half the story, because anteriorly here, this model doesn't show it, but running down here on the internal surface of the thoracic cage, we have the internal thoracic artery and internal thoracic vein, or internal mammary artery and internal mammary vein. I think there's another name as well, isn't there? But these are branches of the subclavian arteries and tributaries of the brachiocephalic veins. Right, so the subclavian artery, as it comes off here, one of its first branches is the internal thoracic artery on either side, and then the internal thoracic vein that is running with the internal thoracic artery, it drains back into these brachiocephalic veins here. So the posterior, so these then, those internal thoracic arteries and veins which are running on the deep surface of this around here, they give off anterior intercostal arteries, which will then run around in the rib cage with the neurovascular bundle between the ribs, and the anterior intercostal veins, of course we're thinking about the blood flow in the opposite direction, they drain into the internal thoracic veins. All right? Right, how are you doing with all that? Let's slow it down and finish off the blood supply bit. So the blood vessels are running as part of the intercostal neurovascular bundle between the ribs around here. And you've got to imagine then the flow in two directions. So we have the internal thoracic artery here, we have the aorta here, they're giving off posterior and anterior intercostal arteries, which means that the direction of flow around the rib cage is going to be like this. And then that blood is going to be into the tissues. And then it'll come out of the tissues and go into the intercostal veins. The direction of flow of blood in those intercostal veins will then be in the opposite direction, so that the posterior intercostal vein will run posteriorly back to the azygos and hemiazygos systems and back to the inferior vena cava, the superior vena cava, and the anterior intercostal veins will run anteriorly to the internal thoracic veins. A couple of notes to add to that then. If you think about the arteries and the veins running with them, the arteries anteriorly give off some cutaneous branches that run superficially to the skin around here, and also kind of almost in the mid-axillary line around here somewhere, the intercostal arteries will give off lateral cutaneous branches that run superficially. So these have got to go through the internal and external intercostal muscle layers, and they're going to get out and supply blood to the skin out here. That'll run out superficially, and then there'll be a branch running anteriorly and a branch running posteriorly. Right? So they really are looking after the chest wall in terms of blood supply and drainage. Another interesting note is that as the posterior intercostal veins get posteriorly back towards the azygos system, they link with veins coming from the vertebral plexus. Normally the flow of blood then is from the vertebral plexuses into the azygos and hemiazygos systems, but it's possible with increasing the pressure inside your thorax, with sneezing, coughing, lifting heavy things and that sort of thing, to reverse the flow of blood, because venous blood is under low pressure. So then you'd actually push the venous blood that's in the thorax back into those vertebral venous plexuses, and that is the route that's envisaged as metastatic cells taking from breast cancer. That's why they end up in the vertebrae. That's the idea. So metastatic, we've done a breast video as well. We've talked about the same thing there, but cancer cells from breast cancer can pass into the blood supply if they erode a blood vessel, and then they can pass with the intercostal veins back here, and then if there's a change in pressure pushing blood in the reverse direction, venous blood with those metastatic cells can then pass into the vertebral plexuses, can get lodged in the vertebrae, leading to metastatic growths in the vertebrae. Right? So that's one reason why this blood supply idea and the way all this links up is important. You know how much I love these models, because these are the ones that fall over. Because look, see, it's all good, but just need to be careful. Right. So now let's talk about the intercostal nerves. So you can kind of see, so you remember in the neck we've got 7 cervical vertebrae and we've got 8 spinal nerves, so C1 to C8, which means that the first, under here, the first spinal nerve that appears underneath, inferior to the first rib, that's the T1 spinal nerve, and that is inferior to the rib. So the spinal nerves T1 to T11, their anterior rami, so spinal nerves when they start they give off 2 branches. Ramus is literally a branch. So we have an anterior ramus and a posterior ramus. Posterior ramus goes to the middly backy bit here. Now the anterior ramus is the nerves we kind of recognise disappearing off around the body and doing interesting things. So the anterior rami of spinal nerves T1 to T11 give off intercostal nerves that run within the intercostal neurovascular bundle. So by remembering all of that, you'll remember that the T1 intercostal nerve runs inferior to the first rib. And of course, we say T1 to T11 because T12 down here, it's no longer intercostal because it's not between the ribs anymore. It's subcostal, it's below the ribs because it's below the last floating rib, right? Now, T1 to T6, or the intercostal nerves under the first 6 ribs, they're the ones that really run around the rib cage, and what they're going to do is they're going to innervate the muscles. They're going to give off branches that innervate the skin. They're going to carry sensory innervation back from the parietal pleura. The parietal pleura is quite a sensitive serous membrane. And they're the ones that are really involved in the thoracic cage. Now, the others, the intercostal nerves from T7 to T11, they're also very much involved in the thorax. They're doing a good job, they're busy, they're getting on with it. But look, as we come around anteriorly, we're getting into the abdomen. So not only are those lower intercostal nerves serving the structures around here, but they're also going to innervate some of the musculature of the upper abdomen, so the muscles of the anterior abdominal wall. We've done that? Don't think we've done that yet, have we? That's one on the list. And they also carry sensory innervation from part of the peritoneum. So they're quite abdomen-y, even though they're considered very thoraxery. See what I mean? Round the back, we've done a video on, probably the same one, isn't it? But the accessory muscles of respiration. Around the back here, we have a couple of muscles, levatores costarum, levate, so that's lifting, levator, right? Costa, ribs. So there's a muscle that can lift the ribs, and then there's serratus, it looks serrated like a knife, posterior. There are 2 of those, serratus posterior superior and serratus posterior inferior, but serratus posterior superior up here, those are also innervated by these intercostal nerves back here. I was wondering what best to show this on, but we're getting there, I promise we're getting there. So, I bet some of you think I've forgotten something, but I haven't. So that neurovascular bundle then is running around inferior to the rib, in the costal groove, running around anteriorly. And just as I mentioned with the blood vessels, the intercostal nerve, as it passes around laterally, so, you know, when it gets around kind of here-ish in the mid-axillary line, it gives off a lateral cutaneous branch. And of course, this neurovascular bundle is running deep to the internal intercostal muscle. So that lateral cutaneous nerve has got to pop out through the internal intercostal muscle and through the external intercostal muscle, because this is a lateral cutaneous branch, which means it's going to innervate the skin. So that gets out to the skin around here, and then it gives off an anterior branch and a posterior branch. So these intercostal nerves are doing a very good job of innervating the skin of the thorax as well. And when they get anteriorly, when they run around here, they pass through the muscles and membranes that are there to get superficially to give off these anterior cutaneous branches to innervate the skin around here as well. So the intercostal nerves are very much responsible for innervating the skin around here, which means if you need to do any sort of procedure where pain relief in this region would be good for the patient, you can use local anesthetic to locally block just a region of the thoracic cage by blocking the intercostal nerves, which is why this anatomy is useful. The thing that you might have thought I'd forgotten is that there is not just an intercostal neurovascular bundle, but there are also collateral branches. So posteriorly around here, quite early on, all of these intercostal nerves and posterior intercostal arteries and veins give off each a collateral branch, and that collateral branch descends to the superior edge of the inferior rib. They drop down to the top of the rib below, and then they follow the top of that rib around here. Now they are smaller, they're not as big and busy and that sort of thing, but there is a collateral branch around here, which means that around here you've not just got your neurovascular bundle under here, you've got another one up here, and those are the collateral branches. Whew. I thought this was going to be a fairly straightforward one, but there's actually quite a lot here, or maybe it's easier to understand and harder for me to explain. I don't know. Are you all keeping up? Because now that's the relevant anatomy. Now we're going to talk about some of the clinical stuff, which makes this quite interesting. Oh, and there's another little thing as well. Right, if you want to, anaesthetize a patch of skin for some reason, maybe a patient's got a broken rib and there's a lot of pain, maybe you need to do a thoracotomy, maybe you need to put in a chest drain. You can then, where the nerves are, and you want to put your local anaesthetic around the nerve. If you do it around, so what you want to do is you want to get close to the nerve, but not too close to the nerve. You don't want to put your needle through the parietal pleura, because that would be bad, wouldn't it? You can find the rib, you can palpate the rib on the patient, and then you can very carefully put your needle in the right place to apply some local anaesthetic. But of course, if you apply some local anaesthetic to the intercostal nerve up here, you're going to completely miss the collateral nerve, which is down here. So you'll need to put some up there and put some superior to the rib below. But of course also, this being real biology, the innervation from the skin around here is actually going to overlap between the different intercostal nerves. You'll probably have to block the intercostal nerves on either side as well to really numb that area properly. Of course you could, if you want to go further back, you could put your block around the intercostal nerve before the collateral branches have been given off, and then you'll block a much larger region of the skin of the thorax, of the thoracic cage, right? So what about if you're putting a chest drain in? Well, I mean, if you want to put a chest drain in, then you're going to be cutting a little hole. You want to put a small incision in there. Okay, so if you're putting a needle, if you're putting a scalpel into somebody's chest, now you've covered generally the relevant anatomy. So you know where the nerves are. You don't want to put your scalpel blade near those nerves. You know where the blood vessels are, so you can avoid those as well. So then you want to put, if you're going to make an incision, you want it to be a horizontal incision parallel with the ribs. I say horizontal, parallel with the ribs is a better description, and away from the two ribs, so you're missing those intercostal nerves and you're not going to damage them. While we're talking about anaesthetics, here's another thing that it's kind of a little bit of extra detailed anatomy, but the sort of thing that might catch you out. Now, if you wanted to if you wanted to block the upper limb so that a surgeon can do some work, but you want to just use a local anaesthetic, you're not going to knock the patient out. What you might want to do is you might want to block the brachial plexus up here in the shoulder, and then you can block all of the nerves going to the upper limb, right? But you do that, you apply your anaesthetic up here, and you test your patient. They've still got sensation around the axilla and on the medial surface of their arm. What's going on? What? Well, the second intercostal nerve gives off a branch called the intercostobrachial nerve. Ow, that's really sharp. Squashing my finger. Bloody plastic things. Anyway, so the intercostobrachial nerve then runs out between in that second intercostal space and passes out to the axilla and out to the medial arm, the brachium, the upper bit, and carries sensory innervation back from parts of the axilla. So even though you've completely blocked the brachial plexus, the patient still has some feeling in the axilla because it's coming from the intercostobrachial nerve and it's going back into the second intercostal nerve. The third intercostal nerve sometimes does the same thing and sends off another intercostobrachial branch into the axillary stuff. But that's quite cool, isn't it? So watch out for that. Don't get caught out by it. Right then, I think that's it. So the idea is that there is a neurovascular bundle running around the rib cage inferior to each rib, and in there we have an intercostal nerve, anterior and posterior intercostal arteries, and anterior and posterior intercostal veins. The intercostal nerves are coming from the spinal nerves. The intercostal arteries are coming posteriorly from the aorta and anteriorly from the internal thoracic artery, and the intercostal veins are anteriorly draining into the internal thoracic vein and posteriorly draining into the azygos and hemiazygos veins. Those are all giving off collateral branches which then run around just superior to the inferior rib. It sounds very complicated when I put it all together like that, but you get the idea. It's, it's a really important and basic and nice, neat structural concept about the thoracic cage that you need to have. And all of those things are important, but they just are. Let's stop there, otherwise I'll be waffling on forever, won't I? Right, see you next week.